Go ahead.
Thank you. Good evening, everyone. I'm Dr. Nilesh Balkawade, Clinical Head, Oasis Fertility, Pune at Wakad and Kharadi Centers. Today, I welcome you on behalf of my team Oasis to this yet another FB Live session. Today's topic is Unexplained Infertility, How to Break the Ice. Most of the time, the patient comes to us and say that we have done all our reports and the doctors have said that there is no problem and we are not able to conceive. So, what's the basic issue and what kind of treatment we should take? Whether we should wait for a natural try, where how much months, years we should wait, or whether we should go for advanced treatment. That's the question. So today we are going to answer such kind of questions which go around a very enigmatic topic called as unexplained infertility. Friends, unexplained infertility is a scenario where a couple is not able to conceive after a 1 year of trial, and also they have done their basic infertility tests. So they have ruled out low ovarian reserve, problems with the ovaries, ruled out problems with the sperms. The tubal testing has been done and the tubes are patent. The uterus is normal. So apparently everything is normal. And in spite of that, they are not able to conceive. So then what's the problem? As I said, friends, apparently everything is normal. So in even in unexplained infertility, it's not the case that everything is absolutely normal. Because in these couples, there may be some reasons where there can be problems, and those problems are not elucidated in the tests which are done routinely. So the routine tests which we do may not be able to detect the problems in such couples, and these problems can be at micro level, and also there can be subtle problems which may not be identified at all. So what are these problems which can be there in a patient of unexplained infertility, and what tests we can do to identify such kind of problems? So uh, for normal infertility testing, we do the ovarian reserve test ovulation study to assess the ovarian function. We do the transvaginal sonography to see the uterine function and the uterine anatomy. We do the tubal patency test by HSG, SSG, or laparoscopy, and we do the semen analysis. In spite of this, if you are not able to find the exact cause, then we need to do certain advanced tests and find out if there is any other cause. So problems within the uterus which may not be identified by routine tests like chronic endometritis or inflammation inside the uterus, then adhesions inside the uterus, this may be missed on routine investigations. So this can be diagnosed by hysteroscopy. This can be diagnosed by checking for endometrium for any inflammation like CD138 molecules. Minor adhesions can be identified only on hysteroscopy. So this can help you in diagnosis. Certain other things like adhesions inside the abdomen, mild to moderate endometriosis may be missed on sonography, and this can be diagnosed by with the help of a laparoscopy. Tubal problems, fimbrial problems, alteration in the tubo-ovarian anatomy, the relation between the tubes and ovaries can be spoiled. All this can be identified on laparoscopy. So, if there is a case of unexplained infertility, we can do a laparoscopy and also try to treat the cause in the same sitting. In spite of doing a laparoscopy, if you are not able to find the cause might exist in certain other uh, parameters. Like if we see the process of fertilization, the every month an egg is formed in the ovary, and that egg gets ovulated, and it's caught by the fallopian tube, and it comes into the fallopian tube. The sperm reaches the fallopian tube, and fertilization occurs in the ampullary portion of the fallopian tube. This is a normal process. So if the ovulation is happening, but in spite of that, the fimbria are not in close contact with the ovary, the oocyte catch by the tube may be problematic, the tubal function may be problematic, and the fimbrial function can be problematic, and this is how the follicle or the egg might be lost. Certain other problems can be in the tubal cavity where the ciliary transport is affected by some sort of infection. So even if the tubes are patent, if the cilia are not normal, This can cause alteration in transport of the egg and the sperm and also the embryo. So this can affect the overall success rate. The third thing is the interaction between the egg and the sperm. This is called as fertilization. So if the egg and sperm interaction is not taking place at all, or if the sperm is able to reach the egg but not able to penetrate the egg, the zona penetration capacity of the sperm is less. So this can also be a failure of a natural try or some other forms of treatment. If everything is normal till now, and if the fertilization is also occurring, then there can be a problem in the transportation of the embryo as we discussed. And the last thing is the implantation. Uh, the attachment of the embryo in the endometrium and its invagination and implantation are another important processes which might be altered, and this can also be a cause of infertility. So embryo might be formed but not able to attach. Then in that case, this can also cause infertility. So these subtle problems we are not able to identify in any of the given tests which are there. So now, with this into our minds, what else we can do? So sperm count, motility, morphology are good, but in spite of that, the couple is not able to conceive. Then a sperm DNA fragmentation can also be helpful. If the ovulation is occurring and everything other is normal, the oocyte quality can be problematic. So friends, how do we find the answer? So in these patients where the couple is not able to conceive naturally, in spite of having all the reports normal, they need to do the diagnostic hysterolaparoscopy if indicated, and if that is normal, they can increase their chances of pregnancy by going for advanced IVF advanced ART treatments, artificial reproductive techniques, and the first form of these techniques is the intrauterine insemination. So couples which are not able to conceive in the natural dry can take help of IUI for around 3 to 4 cycles so that the chances of conception increases. IUI along with ovulation induction agents with tablets or injections is better than a natural cycle IUI. And this IUI number is usually around should be restricted to around 3 or 4, because more than that IUI is not going to help. The success rate of IUI in the patients with unexplained infertility is somewhere around 5 to 10% with ovulation induction tablets, and around 15% if gonadotropin injections are used. So this also depends upon multiple other parameters which should be analyzed before undertaking IUI for the patient. This is the first form of treatment which is which is an advanced treatment rather than the natural try. Ovulation induction only is usually not seen to be useful in cases of unexplained infertility. If IUI ovulation if the natural try is done, if the ovulation induction with IUI is done and that's not successful, the next form of treatment is IVF or in vitro fertilization. Now, how is IVF going to help, or ICSI going to help in such patients? So, as we have seen, the 4 or 5 reasons which cannot be diagnosed on routine tests, all this can be diagnosed as well as treated if we are using IVF. So, if the oocyte quality, yes, it can be assessed when we are taking the oocyte outside. Then the oocyte catch, if it is a problem, the tubal function is a problem. All the functions of the tubes can be done outside in the lab whenever you are doing the IVF. So all the tubal problems are gone. If the egg and sperm fertilization is a problem, then we can take help of ICSI or intracytoplasmic sperm injection. So the sperm can be injected directly into the egg so that the fertilization occurs. And the embryo formation, whether it is occurring or not, can be assessed by incubating the embryo in the lab for 3 to 5 days, and we can get a best embryo. So we will be able to judge where the problem is, and also able to treat that problem. In cases of unexplained infertility, if the problem is not in the egg quality, then most of the times the IVF treatments have a very great success rate when we consider unexplained infertility. So the minor tubal problems, the tubo-ovarian anatomical alterations, then the sperm-egg interaction, then the other problems with the embryo quality, all majority problems can be taken care of when we are doing IVF, and along with that certain other advanced techniques. If the DNA fragmentation is high, while doing IVF, we can use sperm selection techniques such as magnetic cell sorting, microfluidics, testicular sperm aspiration, and so on. So, friends, unexplained infertility is not the end of the journey. If you are not able to find the cause for the infertility, you need to see what's the need to go at the micro level, need to find the absolute cause. If you're not able to find the cause still, then you need to upgrade the treatment to artificial reproductive techniques. Artificial reproductive techniques have been shown to be a boon for such patients. Unexplained infertility for months to years together, or maybe a few more number of years, like 5 years or 10 years, artificial reproductive techniques have been definitely shown as a boon for such treatments, for such patients. If such patients have, even patients who have secondary infertility are not able to conceive, if they have even have a first child, and this the cause of the not conception, no conception for the second time is not elucidated, that is a secondary unexplained infertility, even these patients can take benefit of artificial reproductive techniques such as IUI and IVF, and advanced forms of IVF such as ICSI, assisted hatching, blastocyst cultures, embryo freezing, pre-implantation genetic testing, and so on, to improve their successes. So it's not dark always. There is always a light at the end of the tunnel. You just need to find an expert solution. You need to take an expert help. You can ask your queries to them. You can get the doubts cleared, and in a methodical, scientific way, you can approach to unexplained infertility. There is, I always say that there is always a solution for any bigger problem in life, and also in infertility. So all the best to those who are listening to this video. Those who have this problem can definitely take help of this video. They can connect to us on our mobile numbers, which are displayed on the screen. They can connect to us personally. If they want to visit us, they can visit our Wakad Center, which is at Dynasty Commercial, Kaspati Vasti, Wakad, or at Arisa Avenue, Kharadi, near World Trade Center. All our consultations are free consultations. You can take help of that. And also, those who cannot come physically, a video consultation or a call consultation can be arranged with you. So that's all from me regarding unexplained infertility. Uh, if you have liked this video, kindly share the video and like this video, and share to the persons who basically need treatment if they are not able to find the cause of infertility. Thank you. We'll see if there are any questions. How can I overcome unexplained infertility? Unexplained infertility is always a problem, and the couple starts thinking that if there is no problem, then why they are not able to conceive. But one thing they should get clear, that it's not that there is no problem. The only thing is that that problem has not surfaced up. Basically, there is some or the other problem which is preventing fertilization, or preventing implantation, or preventing the pregnancy. So we need to identify that by doing certain advanced tests, and also need to do take help of artificial reproductive techniques in some cases, which can help to find the cause as well as treat in the same scenario. So unexplained infertility answer is there. You can go through my video. What are options are available? I have already told in the video. Is IVF more successful with unexplained infertility? We have to go in a planned way. So initially, if the patient has had a natural try, then the patient can go to IUI. Control ovarian hyperstimulation with IUI can be the first option. And if that is done for 3 to 4 times and there is no success, then IVF is definitely a good option, because we are not able to find the cause of unexplained infertility, but also able to treat it in the same instance. Which infertility treatment has the highest success rate? Of course, IVF or ICSI, when used in patients of unexplained infertility, has got a pretty high success rate than any other form of treatment in such patients. So if you are not able to find the cause for n number of years, and you have lots and lots of files, but there is no cause found, yes, artificial reproductive techniques can help in that case. can I get pregnant with unexplained infertility? The message is loud and clear. The whole lecture tells about the same, that there is absolutely high possibility when we go by a methodical and scientific approach. Treatment of unexplained infertility is definitely possible, and definitely you can get pregnant. Thank you so much for your patient hearing. I, Dr. Nilesh Balkawade, sign off for today. See you next time with another Facebook live session on yet another important topic. Thank you and bye-bye for now. Take care.